excited for you to all hear about their wonderful expertise and leadership in this important work. And so, with that, I'm pleased to introduce our first speaker, Dr. Jonathan Patz.
Thank you very much. Let me just share my screen. Yeah, really appreciate the invitation to present. And everything look good?
Looks
Yes,
great.
Great. Okay, thank you. Yeah, it's an honor to be with you and presenting today. I'm going to just open things up and talk about climate change and health that's unique to our uncertain times right now, and why we really need to have more public engagement. So I'm just going to show a quick slide that all of you already know. Hang on, I have to just hit something there. Okay. So you have seen, you know the attributes of climate change, rising temperatures, sea level rise, and extremes of the water cycle. And you can see by how old this slide is that we've known of these impacts for a very long time. So I'm not really going to go over these, but it's why I dedicated my career to this problem, because when you look at how many pathways through which climate affects our health and all these climate sensitive diseases, I view this as our largest environmental public health challenge of our times. I just will highlight a couple of relatively new emerging impacts that are scaling up that we hadn't seen as much before, and that's with wildfire smoke. And because you're in many of you are in California, certainly important to you, but all across the United States, you can see the average American getting more exposure. Look at 2021, 2023, and 2025 even, more smoke. So wildfire smoke is just something that is new on the scene, and this is dangerous for our health. You can see this paper from the journal Pediatrics showing that young children are at high risk of wildfire smoke, that those particulates are much more damaging than other sources of PM 2.5. And studies out of Australia, where they have lots of bushfires, show that even short-term exposure to wildfire smoke adversely affects birth outcomes. So this is something that is becoming more problematic across our country, but it's just one of the many health impacts, as I showed before. But we're here today not to dwell on the risks and the crisis that climate change poses, but the opportunities as well, and that transitioning away from fossil fuels. For the last 10 years, I've been pointing out that there are enormous health opportunities. If we just look at three sectors, for example, the energy sector, that air pollution causes more than 8 million premature deaths every year. 5 million of those premature deaths are directly linked to burning fossil fuels. So, if we were to clean up our energy sources, we'd have cleaner air and we'd save millions of lives. Another sector is the food sector, and the energy intensive diets, Western diet, where there's a lot of red meat. That's pretty damaging to our cardiovascular system as well as to the environment, thinking about the water and land and crops that are required for feedstock to grow livestock. If everyone in the world followed what's called the Universally Healthy Reference Diet, similar to the Mediterranean diet, mostly a plant-forward diet, but not totally vegan or vegetarian. But if we were to reduce our meat consumption and follow this diet, according to this Lancet Commission report, that would prevent 11 million premature deaths. And the last sector I want to mention is the transportation sector. And physical inactivity is not healthy. This is a study that showed the that active travel, mostly from walking and biking, improves health and may save upwards of almost 4 million lives every year. So adding up these numbers, 4 million, 11 million, 5 million, that's a lot. That's about a third or more than a third of all premature deaths every year. So I view, getting away from fossil fuels, having a cleaner energy sector, um, plant forward diets and more active travel and cities designed more for biking, that would prevent a lot of disease. Here's some evidence from Paris when they swapped out, you know, car infrastructure for, having more bike lanes, reducing 50,000 parking spaces. Look at the air quality on a given calendar day across different years. Look at how the air quality has been improving as Paris has shifted over to more biking. So there's a lot of good news, as far as the ideal, going across those three sectors, enormous health benefits. But I can't pretend that in the United States we're not experiencing strong headwinds with the new administration. The new administration frees the inflation funding from the Inflation Reduction Act, the infrastructure law. My group had done an analysis of the health benefits of the Inflation Reduction Act, and this is, we've submitted this. It's not published yet, but improvements in air quality, reduction in fine particulate matter from the Inflation Reduction Act, you can see that there would have been great improvements in air quality. Another big reversal, the endangerment finding. This is a finding that the Supreme Court ruled in 2007 that there's enough evidence that shows that climate change endangers public health. It was Massachusetts versus the EPA. They then asked the EPA to, based on their Supreme Court ruling, to do an assessment. And after 2 years, EPA did indeed confirm that, yes, there's enough evidence that shows climate change endangers health. And they enacted the endangerment finding, or that allows EPA to regulate greenhouse gas emissions under the Clean Air Act. Well, this last summer, the EPA wanted to rescind or take back the endangerment finding. They said because of scientific uncertainty. And other things have been happening beyond the endangerment finding. Deregulation of coal-fired power plants, reduction in or throwing away CAFE standards, and the new PM 2.5 rules, and also removing the cost of human life in EPA's decision making, looking at the value of statistical life. This is not an environmentally or health friendly EPA right now. So they asked, there was a public comment period about the reversing of the endangerment finding. And I'll tell you that the National Academies of Science, Engineering, and Medicine did a rapid assessment and came out with a consensus report saying that the endangerment finding was accurate, has stood the test of time, and is now reinforced by even stronger evidence. Also, a expert working group of more than 100 climate change and health experts put in 50 pages of scientific evidence showing vast amount of scientific evidence since 2009. So, unfortunately, the EPA in February repealed the endangerment finding anyway, and they said it wasn't about the scientific evidence, but they were going to repeal it anyway. So now this is in the courts. So this is probably going to be in the courts for a couple of years and go up to the Supreme Court. And I'll finally wrap up by saying, there are reversals in projects, energy projects like solar, wind, asking coal-fired power plants to stay on a few more years. And I interpret this as America last when we think about energy development. And what would the human costs in health and jobs be? My group is working on the health effects of these reversals. What will the damages be if we slow down our transition away from fossil fuels? And the world is moving forward. The rest of the world is going to solar. Price of solar has dropped 10,000 fold in the last 67 years, 80% drop in the last 10 years. So the world is going solar. We're just going to be left behind. The world is also going to electric vehicles. Last year, 1/4 of new car sales were electric, mostly driven by Chinese industry. So what are we to do? Well, we as scientists need to lead the public narrative with factual science. The day that the endangerment finding was repealed, we put out this article saying, Trump says climate change doesn't endanger public health. Evidence shows it does. So we need to be out there, out in the public, which gets back to the title of this talk. And also our lab, as I mentioned, we're doing rapid health assessments of the energy rollbacks. This is an analysis of power plants that are being built for data centers. So we need to get this stuff out into the public. And I'll wrap up by saying that from a colleague of mine, communication scientist Ed Maybach, he says you can describe climate and health in 10 words. It's real, it's us, it's from human activity, burning fossil fuels. Experts agree, climate scientists who work on climate change, most all of them agree. It's bad, there are big risks, but there's hope. As I show, golden opportunity as we transition away from fossil fuels. So in conclusion, today we have the opportunity to seize the moment to transition away from fossil fuels and at the same time vastly improve our health. So that I thank you for your attention and I'll stop sharing my screen.
Thank you so much, Dr. Patz. That was a very important conversation, and I appreciate so much your powerful words on an overview and grounding us in both the urgency of climate change and opportunities for action. So thank you so much. And with that, I am going to introduce and hand it off to Dan Wu. Dan is going to share perspectives on state and local levels here in California on different climate and health initiatives, how those are being implemented. Thanks so much, Dan.
All right. Thank you, Kristen, and thank you, Jonathan. Really appreciate kind of that setting the foundation and the context and looking at the kind of a broader national and international perspective. Again, really appreciate being here today. I am going to kind of pick it up more on those last 2 points that Jonathan mentioned, right? It's bad, but there's hope, and just dive in a little bit more on what we're doing here at the state level through the California Department of Public Health, where I am based. We have a dedicated team here within our Office of Health Equity doing this work since all the way back in 2009. When this became more of a prominent issue. So I would just kind of won't spend a lot of time on this slide, but really kind of going over what Jonathan had previously shared. So many different ways that climate change can affect human health. So highlighted here, the pink circle here is really just emphasizing the mental health aspects and impacts felt. It's been once described to me that, all of these can have various impacts, and then for each physical harm or physical impact, there's usually some sort of mental health element to it that gets affected. And oftentimes those impacts can be longer lasting and more difficult to get over. And I also wanted to stress that, folks who are oftentimes hurt first and worst are those already facing disproportionate vulnerabilities, oftentimes not through their own, kind of individual circumstances, but through broader systems and environments, many of which have been shaped by, racist policies at the structural levels, status quo and practices that benefit some over others, that really create these legacies and environments and conditions that push certain people into more climate vulnerable positions and living conditions, right? And so because the health effects of climate change are worsened by structural racism and other forms of oppression and discrimination, we really can't work towards healthy zero carbon and climate resilient communities without addressing those broader policies and systems and power structures that maintain an unjust status quo. So that is a lot of the framing that guides our work. So we see also there is so much that can be done, like was shared just a few minutes ago. There is so much opportunity to improve health, to improve living conditions through climate action. And so this slide kind of depicts a number of those solutions, and Jonathan also highlighted some of those. But with that, I will dive a little bit more into our team. So this is a picture of us from last January. We grew from a small team of 6 when we first started, and now there was until recently around 20 of us. And so it's continued to grow and really be able to allow us to expand the focus of our work. So we have health program staff members and coordinators, analysts, one climate and health economist, those who support our tribes and local health jurisdictions, and epidemiologists working more on the data and research side of the equation. Our mission really is to ensure that California's actions to prevent and prepare for climate change improve health and racial equity. And we really use a climate, health, and equity in all policies approach, right? Recognizing that addressing all living conditions and factors and across sectors are critical to creating those healthy living conditions in a stable climate that can then allow us to have positive health outcomes at the community level. And going back to the focus on equity, really trying to operationalize that. And we see that as working to have greater fairness in the distribution of power and access to resources. And so that can look like prioritizing investments in communities that have faced in historical and continuing injustice. And then that is the hope then to reduce vulnerability to climate change for these communities in particular. But the actions oftentimes are beneficial to all communities across our state and beyond. I won't go through all of these items shown here, but a lot of our work really is working with our other state agency partners who are mandated to carry out the climate policies of the state. So primarily the California Air Resources Board, they have the big goal of reaching carbon neutrality by the year no later than 2045. And so we support their work in terms of the public health aspect, like what are the health benefits that we can see through climate action across sectors, and what are the things that we should be thinking about as we implement many of these climate actions. And so we also really work on the statewide planning around how do we help communities prepare and plan for the unavoidable impacts from climate change, right? So even if we were to cut, reduce and like eliminate greenhouse gas emissions, like, tomorrow, there is a level of change already built into the emissions that have previously been emitted, that we are going to see some degree of harm and impacts from climate change already. And so how do we best plan and prepare for that? And so bullet 3 highlights a effort led by our Natural Resources Agency in developing a statewide adaptation strategy to climate change. And then as in parallel with that, we have a statewide extreme heat action plan, recognizing that extreme heat is one of the key exposures and threats to California communities. But there's also a number of other efforts looking at nature-based solutions, smart land, climate smart land strategies, our planning efforts, land use efforts. How do we link affordable housing and clean energy to better health outcomes and so forth? So in addition to working with other state agencies, we are also really building out the work within, right? Looking within our own Department of Public Health. This work is being led by my colleague, Robin Pierce, who convenes a intra-departmental working group, right? So public health, of course, as much as I work in climate and health all the time, there's so many elements of what public health does. And so finding those connections to other programs, right? Whether it's in environmental health, emergency preparedness, chronic disease prevention, communicable diseases, and so forth, that is an opportunity that we've been really leaning into. And so we've formed a working group that really invites our partners from across the department. So we have upwards of 4,000 plus, nearly 5,000 employees with like 200 plus programs working on all things public health. Many of those, have connections to addressing climate change. And so from 2023, we started this working group with around 76 members. That's grown to over 200 by late September last year, and that continues to increase in terms of participation and engagement. And again, we have folks represented from our maternal child adolescent health division, our environmental health center, Center for Healthcare Quality, chronic disease, and so forth. So really trying to build our own internal department's capacity to address climate change in a more cohesive way. So moving from the state level, now look, we focus our attention to the local level. So within my section, we have a climate change local assistance unit led by Dr. Elizabeth Rhodes. And their work really provides climate and health equity technical assistance to our 61 local health jurisdictions across the state and to our California Native American tribes, connecting them with each other and sharing resources, strategies, and mutual support through ongoing barriers and challenges, including some of the headwinds that Jonathan mentioned previously. And so as part of this work, we distribute a monthly newsletter with our local health jurisdictions, host office hours with CDPH, our department's subject matter experts. We also provide one-on-one technical assistance to many of the local health jurisdictions and tribes and across a range of topics around climate and health planning, finding funding opportunities, conducting vulnerability assessments, training their staff, and building the capacity at the local level, and more. This slide shows some of the tribes that we are working with. Similarly, we provide technical assistance with them and some little bit of direct funding to them in terms of working with them to develop, for example, a heat mitigation plan with the Pala Band of Mission Indians in San Diego County, and then other smaller funding opportunities to support their work. So we hope to continue to grow this program and the work to support tribes. Okay, so now we'll dive in just a little bit further to a specific pilot project that we've been working on for a number of years now. This is being led by Abigail Ramirez, who is really coordinating and collaborating with community health workers or promotoras in Tulare County, so somewhat closer to the central south of California, in a county that features a lot of outdoor farm worker families. And so this pilot program really is looking at how do you connect weatherization and energy efficiency programs to households that are experiencing chronic health conditions, particularly respiratory conditions, right? Knowing that the literature has found that weatherizing homes can improve indoor air quality, and improve like resilience to heat and smoke and other air pollutants. And so that can help the overall outcomes for those living within. And so really we've been working with the community health workers, connecting them with their local energy efficiency provider to get their homes weatherized. And so that is an ongoing project, and we've been really appreciated working with our local partners. We also have a flagship tool, climate health vulnerability indicators for California, to really identify areas that greater vulnerability to a key number of climate exposures, wildfires, hotter temperatures, air pollution, and sea level rise. And so that's a tool that we've been maintaining and available for use. The URL is there, and I can maybe drop the chat into the chat in a little bit. I will try to just quickly cover extreme heat efforts here at the department. That is an area that we have really been tasked with and also needed to step into more, given just the increasingly hotter temperatures we've been seeing in California, but across many parts of the nation as well. And so the work really falls into 4 key buckets, right? Public health guidance, providing technical assistance, conducting surveillance and applied research efforts, and interagency collaboration, all with the eye towards addressing inequitable impacts of extreme heat. For the sake of time, I won't go through all of these, but these bulleted points at the top just show some examples of the guidance for key population groups that we've developed. And then some of the technical assistance that we have really worked with, particularly with our school-based partners. We have an Office of School Health, and they are county offices of education and other school administrators and staff and school nurses to keep students and youth athletes safe during extreme heat. We did a report assessing kind of excess deaths from a really bad statewide 2022 heat emergency. And so that is an example of some of the work our research team does. And so from that finding, we found that there was an excess of around 5% more deaths than expected during that 10-day extreme heat period. So these shed insights to like our overall planning at the state level and what we might need to do more of to protect and prevent these heat-related deaths. And then finally, just working with other partners, we have a new statewide heat ranking and warning system, the Cal Heat Score, that is being stood up with our support, being led by our state's Environmental Protection Agency's Office of Environmental Health Hazard Assessment. And so that is an exciting new tool that we hope to continue to further use. It is already available, and so they're working really to build it out even further. And then messaging and how to get people just thinking about preparing for heat and the broader just issue of climate change. So, so that was a quick whirlwind. There's a QR code here if folks want to sign up to our newsletter, but some key takeaways that I'll just leave on the screen. Really, there is an opportunity, a really big opportunity to advance health and equity through climate action. So with that, I will turn it back. Thanks.
Thanks so much, Dan. I know many of us know how committed the state of California is to this work, but it was really great to hear even more how, and especially how a lot of these initiatives could easily translate across the country as well into other states. So thank you so much. Next, I'd like to introduce Virginia. Virginia is a award-winning journalist, and she's going to speak about the importance of communication and storytelling in climate health. Thanks so much.
Can you hear me and do my slides show up?
Yes, to
Okay, great.
both.
Okay, great. Excellent. Thank you so much. Happy Earth Day, everyone. Thanks so much for the invitation to share some of the work that I have been doing for the past over 23 years. So let's get started. My background is I'm an independent science journalist. I'm based in Portland, Oregon, and I have been um, covering science for over 23 years. With my background in soils and food production, a lot of my work really focused on kind of prioritized adaptation and solutions. And a lot of it gravitated towards global food security. So I did a lot of stories about trying to secure the world's seeds and the diversity of seeds and utilize those in food production and to try and just make for healthier, more resilient crops. I also did a lot of work on, the changing ecosystems and how that was going to impact species and land use. So really looking at, I did a lot of work on peatlands around the world as they were drying out and being drained and then becoming hotspots of wildfire activities. It was something that just really had lots of different dimensions to it about how we exist in the world and how we need to steward these lands as we go forward. So this was a lot of these stories were for, you know, probably up until about 2020. This was the kind of work that I was doing. And then we had the 2020 wildfires, and I was definitely changed by that. I think that being trapped inside with no AC for 2 weeks with red skies and off the charts air quality indices really impacted me deeply. It was something that initially I did some stories looking at how this was going to affect our crops in the area, but then afterwards, I just really found myself puzzled by so many health questions that were stemming from, a lot of these issues. Like how were we going to understand the long-term health impacts? What was happening to air quality writ large as a result of all of these fires? And so I really started to dig deep and wanted to do a lot of pieces that would track these issues. Um, Fires continue to be, I would say, one of the biggest health concerns, as Jonathan pointed out, and Dan, and they're also just incredibly difficult to study. There's very little rapid response funding for scientists to get in there and do research on, capturing the smoke, looking at what the particulates are in the smoke. But I think one thing that all the researchers agree that I've talked to is that these aren't your grandfather's wildfires anymore. We should start calling them something different. And some people advocate for calling them urban fires because it's not just trees that are burning anymore. These are computers, electric vehicles, batteries, plastics, chemicals. The list goes on. And so I think, for me, this is something that has become really personal, and I've invested a lot of time and energy, like really looking at the LA fires and trying to understand the long-term consequences of both the Maui fires and the LA fires, because in these two instances, we had opportunities for local researchers to get into the area quickly. They had research capacity. Both of them had private donors that actually stepped up when there was no state or government funding, federal government funding that was easily accessible. And they had access. And so I think we're going to learn a lot from these two fires. And so I've been trying to stay on top of that as well. But in addition to acute disasters, so I feel like since 2020, it's been this transition of my coverage has really looked at who's on the front lines of climate change and what is that looking like. Instead of, and like there's still room for adaptation and solution stories, and I still do those, but I do feel like there's just this need. I have this very this drive to share what it's like on the front lines of a lot of these stories. And so I've done a lot of reporting on kind of chronic environmental exposures as well. Notably, a lot of times these impact marginalized communities. So I spent a lot of time in the Salton Sea area, California's largest inland lake, and was really struck by all of the different dimensions of this one area. So this is a farming community. You have Imperial and Coachella Valley farms draining into the Salton Sea. The only inputs are agricultural runoff. It's full of all kinds of chemicals and nutrients. And the sea is disappearing because of climate change and also reduced Colorado River water inputs. So all of these sediments that from farming that have been in the sediments of the lake are now exposed and are becoming airborne. And so we're having a lot of dust storms in the area. And the communities that are on the front lines are immigrant farm workers, many of them undocumented. And so, this is an area where they're growing the bulk of the nation's winter greens, and the communities around there are experiencing asthma attacks, skin rashes, respiratory issues. And the latest research is starting to show that it's not just what's in the sediments, but the water itself, because it's so nutrient loaded, has algal blooms that are near constant, and there could be some of the respiratory illnesses coming off the Salton Sea could be due to that as well. So it's things like this that are really complex, nuanced stories that allow journalists to unpack a lot of the different dimensions of how we're having to now think through managing ecosystems. Are really interesting to do. They're really important to do, but they require a lot from the reader, because it's a lot, and there's a lot of intersections of things that need to be thought through. Um, I would say that journalists have, it's really difficult to do this type of journalism in a piecemeal fashion, but we're figuring out better ways to communicate stories holistically. In 2024, I was very fortunate to be part of a series of articles that ran across three different outlets. So we had Vox, Grist, and the 19th, which is a online outlet dedicated to focusing on women's issues. And we banded together, and we did a four-part series that ran across all three outlets at the same time, really digging in deep to how was climate change impacting women's reproductive health? We had, for Vox, I looked at how heat waves were increasing the number of risky premature births, and really looking at how these changes are happening all over the world. And then Jessica Coots and Zoya Tierstein also did some really important reporting on how IVF injections, really time-sensitive, costly IVF injections are at the mercy of hurricanes. And so there was, a big issue around those. There's lots of reporting happening about how rising seas and saltwater intrusion are also going to impact reproductive health, notably in Bangladesh, but also in other areas. And then there's also malaria risks that are rising around the world. And so I feel like the nature of storytelling has taken a kind of a sharp turn from expectations and anticipatory projections of what climate change can be and to now everyday reality. And it's really heartening to see scientists really kind of lean in and actively do a lot of work to link planetary and human health. We're seeing, I am now convinced that these types of stories are exactly what we need to create the dialogue that's necessary for robust discussions about cultural changes that need to take place, whether it's related to diet or energy usage or overconsumption of resources. I mean, one thing that I've learned over the last couple of decades is that nobody likes to be told that how they live is harmful to the greater good. But I am increasingly convinced that these are the kinds of conversations that we can no longer avoid. So here are some examples of scientists and communities that are making links between planetary and human health in inspiring ways. Raquel Peixoto is a microbiologist. She's based in Saudi Arabia, and she's figured out a way to treat coral reefs with probiotics, specifically with beneficial microbes that can help aid their survival in warming seas. And she's also really pushing hard for microbiologists to have a seat at the IPCC table. I think I'm kind of was dumbfounded when I did this story that microbiologists weren't already there, given the formidable control over greenhouse gases that microbes have. But she's really pushing for that and wants to incorporate different types of scientists at the climate table. And I think that's a positive move forward. And then I also was fortunate to get to go down to the Klamath River and do some reporting about federal, state, and tribal partnerships that came together to purposefully reseed this vast area that was riparian area that was going to be exposed after the dam removals on the Klamath, and really showed the intentionality and the 7 years that it took to grow enough native seeds to swiftly move in after the dams came out and flow was restored so that they could cover this area with natives as opposed to allowing invasives to just move right in and create, a fire risk and otherwise undermine the restoration effort. So I think, there's always this place for solutions journalism, but I wanted to also include just a quick note of caution that a lot of what a journalist's job is to be skeptical of everything that's presented as a solution. And one of those areas is sustainable aviation fuel. I mean, I want sustainable aviation fuel. I think everybody wants that. But I think you have to be really critical of some of these ideas. And I think with this one, every way I looked at it, every person I talked to, it is not possible to grow our aviation fuel without consequences to, in this case, native habitat for pollinators, food production, land values, pesticide runoff. All of these were going to be very significant consequences. And so I just really want to caution everyone to retain their critical thinking when it comes to the climate solutions that are presented to us. And, that kind of gets to the other big challenge that's facing science journalism right now, and that is that it's getting more difficult to tell these stories because of the rise of misinformation and disinformation coming from the highest levels of the government. The current president calls the climate change threat to public health a scam. The EPA, head of the EPA is giving keynote conferences at anti-science or keynote talks at anti-science conferences. And while the science will ultimately prevail in the long run, misinformation can cause significant long-term damage. And we're seeing that in the dismantling of environmental regulations and the loss of research capacity, which could take, decades to rebuild. And so I think there's just a lot of journalistic real estate being devoted to fighting disinformation at the moment. And on top of that, we have AI, who is now proliferating the landscape with a lot of academic papers that don't exist. News outlets are fabricating quotes in stories, and we're just really in uncharted territory when it comes to trust in science and trust in the news. On a more hopeful note, there is the nonprofit news group covering climate now has embarked on a year-long campaign to emphasize that scientific studies routinely find that 80 to 89% of the world's population want stronger government climate action, and they are promoting that and making sure people understand that we're not in isolation. There are more of us that want change than there are that don't. And so I think that that message is something that I've been trying to get out loud and clear over the last few months. And lastly, I went into science journalism to write about the people doing the work to guide us towards a more sustainable future. And so it was heartening to see that there is one thing that can still bring people together, and that is awe. The Artemis 2 images were a timely reminder that the beautiful blue marble that we live on can still inspire awe and appreciation, and that it's the only place we know that harbors life in the universe. And so it shows the power of science to inspire and connect. And so I'm really grateful that on this Earth Day, we got a powerful reminder that healthy humans need to ensure that they have a healthy planet. And I will end there.
Thank you so much, Virginia. What a beautiful way to end your talk. Certainly, there are many wonderful moments on this planet, and it's such an important reason why we keep taking care of her. I invite all the speakers to come back on screen now, and I'll open it up for any guests that would or audience members that would like to ask any questions. In the meantime, while we wait, we just have a few minutes left here, but while we wait for questions, I'll just pose a question to the group. You all talked about solutions and hope and also just sort of the direness of where we're at, but I'm just wondering, what else could we be doing as institutions or individuals to make things better? What sometimes I think I feel a little bit lost, and I'm just the one small person here. So, what are some other things that we could start with, might you think?
I might jump in as you said, I'm one small person, and I'll channel Bill McKibben, who said the most important thing an individual can do is be less of an individual. To join groups, amplify your voice, obviously lead by example, but really to join with others. I was so, right now we've got a lot of backsliding on environmental policies, and I was so uplifted by seeing how more than 100 scientists gathered to push back, and pushing back is quite gratifying when you know that you're advocating for what you believe in is true science. So gathering and joining up, I think, is something really important to do.
Yeah, maybe I'll jump in and kind of add to that too. I think so. I didn't start my career in public health. I was more in like architecture and planning and all like environment, and then realized like everything that with design, plan, build really has like a direct or indirect effect to health. And from that, really like looking at this like broader environmental context that we all live within, and the stable climate that we have, like really like climate change became the biggest issue that affects so many of these other issues that we are facing. And so when I transitioned into public health, I think one of the things that I really had my eyes open to was just the idea of like moving away, right, from that individual stance to a collective community perspective, right? Like kind of how public health practitioners are kind of the health professionals, that the patient is the population, right? Here for me, California is the population that we focus on. And so just similarly, the solutions I think that many forces have kind of focused on are like individual level solutions, and then also like kind of the guilt that is attached to not being able to kind of break out of this cycle of like, feeling like, oh, I need to drive to my, doctor's appointment or drop my kid off, that, and I am contributing to the problem. I feel guilty, but and so it's like locked into this mindset, but like stepping back a little bit, right? Like why are we in this situation in the first place? What got us here? What are those higher level policies and systems that really continue to stay in place, not by accident, and how do we work to dismantle those? And so from a state perspective, really looking at wholesale, like as fast as we can, transitioning to clean energy sources and trying to move away from like this technological fixes alone, but like what are those things that really can build community that benefit like community level health? So walking, cycling, transit, those may not be as flashy in terms of like technological solutions, but they have so many benefits that like so many communities that can't even walk safely due to the lack of sidewalks, right? And so when they hear about solutions that are very focused on technology alone, it's a little bit out of reach, right? So how do we reach all folks in this transition to a clean energy future as fast as we can at the community level?
Yeah, I'll just echo everything that Jonathan and Dan said and just say stay engaged. And I think that honestly, the only way forward is through collective action. And I think we've seen that over and over again. And um, I definitely am picking up on more reticence to try to just focus solely on tech fixes. I just think that that's not something that's going to be as fruitful as coming together and figuring out a better future all the way around.
Well, thank you all again so very much. I'm going to hand it back to Sherry for closing because we are still here at just our last few minutes. And thank you and happy Earth Day to all of you.
Great. And just before I close, I just want to see if anyone has final comments because we do have 2 minutes left. If there's any final things you wanted to add, and if not, I will go ahead and close. Okay. Well, first of all, thank you tremendously for sharing your expertise and insights. And we're also grateful for everyone who came to join us today. It's so encouraging to see all the progress and innovation happening in research, public health, and journalism, particularly in the challenging times we face ourselves in. But it is really excellent to see the shared commitment to advancing climate solutions that improve human health and equity. We will be sharing the recording with registrants, and you can find the recording along with recordings of our past webinars on our YouTube channel. And someone from our team will be sharing the link in the chat right now. And thank you again for being with us here today. And we hope you have a wonderful rest of your day. And thank you again for the wonderful speakers. Thank you very much.
Sherry.
Thank you.